Coming up on Nursing Success TV. This month, Dr. Phyllis looks at options for delaying retirement, and we meet Elerie Archer with ideas on taking charge of your career.
Ask Dr. Phyllis is brought to you by New York Presbyterian Hospital. Amazing things are happening here.
Today's question for Dr. Phyllis comes from RN Rosie in New York, who writes, "In 2010, after 30 years of nursing, I had to delay my retirement plans due to the economy and my husband being unemployed. We still need my paycheck, but now I'm just fried. I have a bad back, extreme fatigue, and constantly worry that I'll make a mistake and harm a patient. I feel trapped. Do you have any ideas that I could present to my manager to stay employed but on a less rigorous schedule?"
Rosie, I don't know how old you are or in what area of nursing you're currently practicing, but if you are 62 years of age, I certainly would have a serious discussion with my accountant and explore the options of perhaps starting to collect Social Security. Now, you're not going to get as much as if you waited until you were 65 or 66, but it just may be enough for you to be able to go to part-time hours. Just keep in mind that this decision to go part-time could affect your health care benefits, so you want to make it thoughtfully. However, if you need to work full-time and you're currently working in a physically demanding area, then you may want to consider the options of infection prevention, staff education, discharge planning, documentation specialist. They're all very demanding, very rewarding positions, but they're a lot more forgiving on the consequences of practicing for 30 years. I know your manager doesn't want to lose you, but you do have to put yourself first. So it may be time to leave the facility. Home care can be a lot more flexible, and certainly consider school nursing as a viable option.
Email your questions to askdrphyllis@nursingsuccess.tv. Elerie Archer is a busy nursing professional working full-time as an ICU Clinical Coordinator with SCL Health System in Denver and as Vice President of the Eastern Colorado Council of Black Nurses. Today, she shares how to take control of your own career path.
So I've been a nurse for about 23 years, and the reason why I chose to go into healthcare was because I enjoy helping people. I like to help them feel like they are empowered with whatever disease process that they're going through, and to be able to give them the knowledge and the resources that they need to overcome it and not let it be a burden for them, but to create independence and ways for them to function and learn to live with the disease. I was very open to non-traditional jobs, I made sure that I was always looking on the internal website to see what jobs posting there were, if I was qualified, going to talk to the managers, the recruiters. I worked in a clinic as a clinic nurse, did OB, adult health, pediatrics, and then I became a nurse educator, which was my most rewarding job. And then after that, I actually worked in a jail, and I was like, okay, I got one more thing on my bucket list, and that's to do critical care. And I started working in critical care about 5 years ago, and I really enjoyed that aspect. I actually started with the Professional Black Nurses Association. It's actually called the Eastern Colorado Council of Black Nurses. And I started with them when I was in nursing school, because in nursing school I had challenges as well. There was maybe 3 or 4 Black nurses or nursing students in the program, and we were just having a hard time. We felt like they wasn't understanding us, they wasn't giving us the same attention as our counterparts. So they actually recommended that we go and seek out a professional nursing organization, and I did. And it was so enlightening to see other nurses that were like me, that had the same struggles that I had, and were able to give me that support. They were sympathetic and empathetic at the same time, and was really mentored me and guided me and gave me advice on how to navigate the nursing field and how to come into my own as a nurse. And this was a very good resource, being in a professional nursing organization. And I'm also a part of the Colorado Nurses Association too. I think belonging to a professional nursing organization will give you all of the tools and resources that you need and to be able to be an effective nurse in any healthcare organization. I think it opens up a vast amount of opportunities to take you into areas that you may not even thought about before. A fellow member of my professional nursing organization, she had just graduated nursing school and she only wanted to work in critical care or the emergency room. And you know, me and some of the other nurses was talking to her and was like, well, you're limiting yourself and you're a new grad, it's very competitive. You know, usually those types of jobs come internal for people who have been working in their system for a while. So, you know, you have to be willing to broaden your horizon. And she, you know, 9 months went by, she didn't have a job. And then one day I was like, you know, what about school nursing? And she was like, school nursing? I don't want to do school nursing. And she was like, but I need a job. So she went and did the interview and she did get the job. It was the first time that they ever hired a new grad. So she was kind of like a test pilot and she loves it. She brags about it all the time. She loves her kids. She loves the experience that she's able to do to create, you know, healthy choices for the kids and to have them be empowered about their bodies and making sure that they're safe in school. And just with her being open to different suggestions that we were giving her. And I think all new grads need to do that. Yes, we have our ideal jobs that we want to work in, but we have to take baby steps in order for us to get to those jobs. We have to be willing to maybe sacrifice on the front end to have big gains on the back end. First, you need to come up with a plan of what is it that you want to do? What are you passionate about? What lets you know that you still have that fire in your belly, whether it's pediatrics, whether it's critical care or emergency medicine, and then kind of set your sight on those professional nursing organizations that can help you, you know, mentor you and coach you through the process of getting into those positions. So it comes with building your resume and networking and professional nursing organizations and talking to managers and going to visit those floors or those units or the facilities where you desire to work. And, you know, once they see you and you can volunteer once a week or twice a week, and they start seeing you more and know your work ethic and know your personality, then, you know, they grant you an interview and you'll be working there. And I think it's important to be proactive. I'm not going to sit and wait for someone to tell me this is what you should be doing to advance your nursing career. You know, I'm going to look at those opportunities to advance my own nursing career because I know what's important for me. I know what I'm passionate about. And so I think it's important for us just to be proactive and not reactive.
Thanks for joining us today, and remember, we want to hear from you. Click the banner below this video player to share your ideas and suggestions for Nursing Success TV. We'll see you next time.